The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Welcome to today's edition of Meet the Doctor. My guest this afternoon is Nicholas Jones. He's a double board certified plastic surgeon in Atlanta. Welcome to the show, Dr. Jones.
Thanks for having me.
Now, I have two little girls and they love the song Dr. Jones. Does everyone sing that song to you?
You know what? It just depends on the audience. Are you talking about the Indiana Jones?
No, the one by Aqua. Like the same people who sing the Barbie Girl song, they have a song called Dr. Jones.
How does the song go? Sing it. Give me the
You're
chorus.
gonna make me sing it.
Give me a chorus. Go ahead.
Dr. Jones, Jones, calling Dr. Jones.
You know what? I don't know that song, but I do get the Indiana Jones. I do get the Dr. Jones. Yeah, from Indiana.
Right.
From what's the name of that movie? Indiana Jones. Yeah, that's it.
Temple of Doom. Is that the one that one is from?
Yeah, that's it.
Dr. Jones, Dr. Jones.
Right.
Okay, so now that we've got that out of the way, what part of Atlanta are you in? It's a big city.
So my practice is in Paces Ferry. So they still consider this part of Buckhead, but it's, northwest. Yeah, northwest Atlanta. I'm in the perimeter. So they say there's ITP and OTP. OTP is outside the perimeter.
Is it important to be ITP?
No, it's not important. But, when people say they live in Atlanta and let's say, are you married?
Mm-hmm.
Okay. Well, let's say you weren't married and you were coming to Atlanta to visit a guy and he was like, where do you live? And he said he lived in Atlanta, but he actually lives in Woodstock. That's like a 2-hour difference. Yeah.
Not Atlanta.
Yeah. Atlanta's pretty spread out. So Buckhead is probably one of the high-end affluent areas. And I would say most people with a little bit of money, they probably live in the northern part of Atlanta, northwest, like Buckhead, Sandy Springs, Alpharetta, Milton, all of those places.
I got it. So how long have you been there? Your whole career?
No, I've been here for about 4 or 5 years. Prior to being here, I worked for a hospital in Charleston, West Virginia. And then prior to that, I did my training in Augusta, Georgia. I'm from New Orleans. Did medical school in New Orleans, undergrad in New Orleans.
I can hear it now.
Xavier University of Louisiana and LSU for med school. And then I did a general surgery residency at Albert Einstein and plastic surgery at Medical College of Georgia.
So in the 5 years that you've been in your office there near Buckhead, have you become known for anything in particular?
What am I known for? I'm known as the greatest plastic surgeon in Atlanta, like by far the greatest. No, but what am I known for? Probably body contouring, Brazilian butt lifts, mostly body stuff. So breast and body. So I think I do a pretty good job with the breast and the body. And I'm probably when it comes to awake liposuction, I'm pretty comfortable with that. And I can get really good results, whether you're asleep or awake. And a lot of patients these days, there's a fear of being put to sleep. And so by offering them awake liposuction, a lot of patients just like that.
Where do you suppose that fear of anesthesia is coming from?
Lots of places, but I would say the biggest is probably the media, because we all have access to the internet. We all spend an excessive amount of time on social media platforms. And so when a celebrity has a procedure done, or they've, had a complication, or somebody's had a problem, somebody's died, we all hear about it. So you don't hear about 200 million surgeries that have gone without any complications, but it's the ones that have those those fatal
Right.
outcomes, and they tend to make more noise than the standard.
So if someone is coming to you for awake lipo, they've already heard that you're great at this from someone else. Is that what's happening?
So either they've heard from a friend or they've seen some of the results on the internet, or they're just inquiring and, show up in the search engine and they do a consultation and, find out a little bit more.
What would the benefits of being awake be other than it's not as scary as being put under?
I would say the number one benefit for the patient is they don't have the risk of anesthesia. Now, that could be a good or a bad thing. So if you have a decent pain tolerance, it should be fine. But the biggest advantage is the downtime from you have no downtime as a result of anesthesia. Now, you still have to allow your body to recover, but the advantage is you go home and go about your, normal routine. You have to rest, but you just bounce back faster. But for me as a surgeon, one of the benefits is positioning, like being able to position a patient however I want to get to the area that we're focusing on.
Because they can help you get in the right position? They can move?
Yeah, the patient can help me. And also with liposuction, one of the variables is vectors. So the more vectors you can use to get to a targeted area, the higher likelihood you are to clean that area out of fat.
Mm-hmm. Is there a limit to how much you can take out with awake?
I mean, there's the set limit total, whether it's awake or asleep, is 5 liters. Now, when patients are awake, taking out 5 liters could be a little bit more risky because generally when you're doing awake liposuction, the patient isn't getting any IV fluids or anything. You're monitoring them, but you don't have an anesthesia provider closely monitoring the patient. So I personally wouldn't be as aggressive when, removing fat. So 5 liters is a max, but most of the time I don't take out 5.
Mm-hmm. Do you have a surgery center there that's yours? Are you going to a surgery center, hospital? What does that look like?
So I do procedures in my office, and that's strictly like minor procedures in awake liposuction. But when I have major procedures in which the patient needs general anesthesia, I have a surgery center. And then I also operate out of a hospital, just depending on, the patient's needs. From collaborating with another surgeon, like a gynecologist, and they're having a hysterectomy and I'm doing a procedure, has to be done in a hospital. But for the most part, I do most of my surgeries at a privately owned outpatient surgery center.
On your website, there's quite a few interesting things that stand out to me. One is that you have listed on here that you will treat paradoxical adipose hypertrophy.
Hyperplasia.
Mm-hmm. Which that's the side effect that comes from cool sculpting, reacting badly to cool sculpting, isn't it?
Right.
Have you seen that a lot?
Yeah, I'm not going to say frequently. I've treated, a handful of patients, like here and there, they come, but I don't offer cool sculpting. So the patients, I don't know
that was my next comment. You don't, I can see that you don't offer it.
I don't know how they find me, but they come and what happens is cool sculpting is cryolipolysis. They're freezing fat and the fat cells lyse and your body just resorbs them. What happens with the paradoxical adipose hyperplasia is even though you've lysed these cells, the remaining cells, they produce more fat and they swell up. And then the patients have this kind of funky look where they have some kind of like scarring hardened areas, as well as they just kind of mushroom back up or blow back up. And the treatment is liposuction with some sort of energy device. And the reason I use the energy device is because, like I said, it's oftentimes hard to evacuate the area after they've done a cool sculpting. And so the ultrasonic energy helps emulsify the fat or melt the fat.
It's such a disappointing situation for those people because they were trying to get rid of their fat and then it
Yeah.
went the other direction through no fault of their own. So what's interesting, I think, about cool sculpting and this, sort of related to this condition is that I'm starting to hear that people just are not going to do it anymore because they can lose weight with the skinny shot or semaglutide or tirzepatide. So I'm curious, in Atlanta or in your office and the people that are coming to see you, is that what you're seeing start to happen?
Yeah, so I definitely have way more weight loss patients. I have more patients who come to me who have excess skin. And then I do offer the medication here in my office. I offer it because I see a lot of patients who aren't really good candidates for surgery. And the weight loss medication can help them become a candidate for surgery. And the weight loss medication, it really is effective at helping them lose weight. And when they do lose weight, it also helps them to become a healthier person. Like I've had patients who, they lose weight. They no longer have to take their antihypertensive medications. Their diabetes has resolved. They're happier. They can move around better. The arthritis is better. So I think it has a lot of benefits, even if they decide not to have surgery.
It's true. Can you think of any specific success stories of people who've gone through that with you and how they're different now?
Oh, yeah. I mean, I have lots of them. I have patients who've lost 70 pounds on the weight loss shot. I've had patients who weren't candidates for surgery. They lose the weight, they come back, we do the surgery, and they have amazing results. I have patients who, probably needed a tummy tuck. They didn't want one, but they had this loose skin. I did a wake liposuction on them with the skin tightening, and they got the result that they wanted. Yeah, lots of success stories. And I think he's going to continue to see patients coming in for plastic surgery after weight loss because, America, we don't have the best diet. So there's always going to be a cohort of obese patients who want to lose weight.
Why do you think an aesthetic practice is the best place to get your semaglutide shots?
I don't necessarily think it's the best place. I don't really know if there's a best. That's a tough question, but I think for me, I offer it because, I see a lot of patients who aren't candidates for surgery. Also, I feel like by offering them the medication, I'm also like their primary care doctor. I'm doing something for them that even if they don't have surgery, it would benefit them in the long run.
It's so expensive to go to your primary care doctor now anyway that we should all just go to plastic surgeons for everything, I think.
Yeah, you should. Come and get your weight loss medication from Nip and Tuck Plastic Surgery.
Thank you for saying that. Why did you name it Nip and Tuck Plastic Surgery?
I actually wanted to name it after myself, but the name was taken. And so I was just trying to think of something that was cool. And so I came up with that. I know there's a show called Nip Tuck, but I've never watched that show. And so I just was like, Nip and Tuck sounds cool. And I hadn't seen anyone with the name. I actually came up with the name before I opened maybe a couple of years before I opened my practice.
Okay, but who has your actual name? The other Dr. Jones?
There's lots of Nicholas Jones. Yeah.
And there's other Nicholas Joneses that are plastic surgeons?
No, not plastic surgeons, but there's lots of Nicholas Jones, MDs. But I'm probably the realest one. I'm probably if you Google Nicholas Jones, MD, in any part of the world, I should show up first.
You did. I did that. You were there.
Yeah, I'm glad you were able to do that.
But what's your middle name? Do you have an interesting middle name you could throw in there?
Yeah, it starts with an I.
Intriguing.
Yeah, Nicholas Intriguing Jones. That's it. No, it's Isaac. Isaac.
Oh, I was going to guess that.
Yeah,
I'm glad
it.
I was right in my head. It's a good middle name.
Yeah, thank you.
You grew up in New Orleans or you just went to school there?
I'm from New Orleans, so I grew up on the West Bank of New Orleans. I lived there until I finished medical school. So that was the first 20 plus years of my life in New Orleans.
So were you there for Katrina?
No, I was in my residency.
But surely you knew lots and lots of people.
Yeah, my parents were there. So there was periods of time where they didn't have any phone service and people at work were asking me about my family and I had no idea how they were doing. So it's kind of scary. Yeah.
Yeah, I can imagine. I was in Houston. Within 2 weeks, the whole city of Houston was full of people who had left New Orleans and come over.
I bet.
'Cause it was kind of like the next closest big city. Yeah, it was a scary time. When someone comes to see you for the first time, what should they expect from that visit?
They should expect to be welcomed. They should feel really comfortable. And during that time, we're going to just have a conversation about what it is that they desire, conversation about what I can offer and what I cannot offer. And we're going to talk about whether or not I feel I can safely perform a surgery that they're requesting.
Are there times where you send people away or send them somewhere else?
Absolutely. Yeah, I send patients away. If you want something and I don't think you're going to get the result that you desire, then I can't do the surgery. If it's too risky, we can't do the surgery. And if you're just unrealistic, I can't do the surgery.
Is it hard to tell people no?
Not really. No, because at the end of the day, it's my license. And I just want to do what's safe for the patient. And if they want something done and I don't think it's safe, then we can't do business. It doesn't happen a lot, but I turn patients down.
Have you ever noticed that there's something that those people have in common? Like, are they usually there for the same kind of procedure or are they all just different?
They're all just different. I mean, there's certain red flags that you have to pay attention to. Like you have a patient who's very pushed, like rushed, and they want a surgery immediately. That's a red flag. Like more than likely they've been somewhere else to see another doctor and they were scheduled for surgery and maybe at the last minute it got canceled because their labs came back and something was abnormal, or you see the patient, they get their medical clearance and all these medical problems show up that they didn't discuss with you. That's a red flag. Patients getting surgery to please a spouse, red flag. Patients who have very minor abnormalities or anomalies and they focus on it, that's a red flag.
Earlier today, we were talking about people who are running from the law and get plastic surgery so they look different. I think that would be a red flag.
Absolutely.
Okay, so what else do you like to do when you're not at work?
I have a dog. I have a giant schnauzer. I like to play with him. He's a puppy. He's 7 months old. His name is Satchmo. He brings me a lot of joy. He's funny. He's a big dog, and whenever I'm home, he just follows me around all day. I play golf when I have some time. I hang out with my wife. I like to eat. I eat out a lot. Like I'm an expert when it comes to dining.
Is the food in Atlanta as good as New Orleans?
No. I can't think of any place where the food is better than the food in New Orleans. New Orleans has the best food.
I'm not going to fight you on that one.
Mm-hmm.
Well, if someone is listening or watching on YouTube and they're interested in coming to see you, where should they find out more information about you?
Okay, yeah. Go to the website, drnipandtuck.com, www.drnipandtuck.com. There's a nice photo gallery there. There's some information about me, the procedures. I have a YouTube channel. We, give out some information. And then on all those other social media platforms, like if you want to see more before and after pictures, see me in the OR, all those things, it's on social media. Yeah. Or they can just call the office 404-777-TUCK, TUCK. Yeah.
Nice. Your Instagram is very clear that you have a sense of humor, and it's refreshing because most doctors do not have fun with their Instagram, but you're definitely doing that. So
yeah, thank you.
I'll put the links to the show notes for everything so they're easy to find.
I think I'm a humorous person. I don't know if I could be a stand-up comedian or anything, but I think I tend to make people laugh.
I think I'll put you in my I have a hall of fame and a hall of shame where I save good examples and bad examples of stuff.
Oh, wow.
And the thing that I always look for on Instagram is, do you make me want to click? And I want to click on almost everything here. And it's really good.
Do you go to the, what's the name of that, South by Southwest? Are you a music person?
I am, and I don't usually go, but I have to go this year, so I did get a badge.
Yeah, there's some good restaurants in Austin. You know what? I stayed at this resort, this like wellness resort. It's called Maraville or something like that. You know that place?
Mm-hmm.
You've been?
I have not been there.
Yeah. It was a lot of wellness stuff.
Was it great?
It was cool, but like I'm not a wellness person, but I wanted to try something different. I think 3 days is enough for me, but I stayed for like 5.
Did they make you eat like wheatgrass and spinach and stuff?
No, they didn't, but the food was really clean, and they had all these like exercises and workshops of like, getting to know yourself. And it was worth it. It's just after about 3 days, I had enough of it though.
Yeah.
Yeah.
Sitting by the pool in Las Vegas is my idea of a break.
Yeah, definitely.
Well, thank you for doing this.
Thank you.
If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.